Hello everyone, today we are going to talk about spinal stenosis. Spinal stenosis refers to a narrow spinal canal that commonly arises from degenerative changes in the bony structures or ligaments of the lumbar vertebrae. Surgery to decompress the entrapped spinal cord is usually recommended, but complications occur quite often. However, non-surgical treatment, including traditional Oriental medicine, has recently been identified as an important treatment strategy for decreasing pain and improving function. It is therefore commonly recommended as initial therapy for spinal stenosis when no neurological contraindications or symptoms are evident. Although these alternative treatments are not considered part of traditional Western medicine, many patients have reported that these treatments have helped. These therapies are swiftly becoming part of conventional medical treatment and include acupuncture, homeopathy, and massage. In this video, we'll discuss everything connected to spinal stenosis, including symptoms, diagnosis, and therapy, as well as the role of Oriental medicine in the treatment. Our role today is to answer most of your questions regarding spinal stenosis. Today we have Dr. Raymond, who is the leading doctor at Jaseng Hospital of Korean Medicine. He's going to discuss with us everything about spinal stenosis from an experienced medical point of view. Hello, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So what is the spinal stenosis?
Spinal stenosis is a disease related to our spine, or a vertebra, or our back, could be in the neck, could be in the lower back, spinal stenosis. Yeah. And at the end means that the spinal canal, where the spinal cord, the nerve, the central nerve from the brain goes along the spine down, the whole spine until the lower back. This spinal canal, where the spinal cord, the nerve goes through, this canal gets kind of constricted because of whatever cause. If the canal gets smaller, constricted, then it might kind of compress the spinal cord, the nerve. If the nerve, the spinal cord is compressed, then it usually produces symptoms, which is usually pain, maybe sometimes in combination with numbness.
In that area?
Not so much. Of course, it can be also in that area, but it could be also radiating down the legs if the spinal stenosis is in the lumbar area, or it could be radiated to the arms if the spinal stenosis is in the neck. And what are the causes of spinal stenosis? We see it mostly, of course, there are some traumatic accidents which also could injure your spinal tissues, but in most cases it's aging, so it's kind of a degenerative problem. We see the spinal stenosis when we look into spinal disease, like disc herniation, disc between the spinal bones, there are some discs. And disc herniation means that because of whatever reason the disc starts to come out and kind of pinches on the spinal cord or the nerves that go down the extremities. So the nerves are pinched, irritated, you feel pain and numbness. So when we talk about those kind of spinal disease, then we say spinal stenosis is the final act. Spinal is the last stage of spinal conditions. So that means the degeneration is already ongoing for usually many years. The spinal tissue gets weaker and weaker. Because of this, the disc come out more and more. At the same time, the ligaments that also cover, and those are ligaments inside, they get thicker and thicker. And then at the end, inside the nerve, the space gets smaller and smaller. On one side, the disc come out. On the back side, the ligaments thickened. So at the end, it presses the spinal cord, and then you have the symptoms. Usually for spinal stenosis, the symptoms they feel most is pain. In the area and radiation pain, maybe in the legs or in the arms. And especially when it comes to the legs, it's getting more and more difficult to stand straight. So standing straight and walking becomes more difficult. So the more progressed the spinal stenosis is in the lower back, the less they can walk without pain. So when it comes to situations, for instance, when the patient cannot walk more than, let's say, 5 or 10 meters, and then the pain is so severe that they have to sit down, because that is usually what relieves the pain, is when you bend forward. So that relieves the pressure, and you feel less pain. So after 10 meters, for instance, you have to kind of sit down or bend forward, that it relieves, and then you have to stand up and have to walk again. So that's a really very severe form of spinal stenosis. But usually it starts slow, as I said. So first, maybe you have problems when you stand for a long time. Then you feel the aching. Or when you walk for a long time, then you feel the aching in the lower back. So that's how it starts.
So does the lifestyle in early ages affect the likelihood of having spinal stenosis?
The lifestyle, of course, can affect, because especially modern people, the biggest problem is sitting. And sitting in front of computers all day long. So when we don't move our spine, what happens? The blood circulation in the whole area, in the spine, the bones, between the bones, the cartilage, the discs, especially the discs, they don't have really blood vessels themselves. So usually the blood supply there, they get the nutrition by when we move. When we do whatever move, then they get the blood supply from the bone marrow, from the vertebral bodies, up and down. But if we don't move, means when we sit all day long, then the discs and the tissue starts to get starved. They don't get the nutrition because they don't get enough blood supply. And that leads at the end to degeneration, the discs and also the area. And the longer this process of degeneration lasts, the higher the chance that you develop either disc herniation or later on even a spinal stenosis.
So how is it usually diagnosed? Is it by a scan?
Yes, in modern days we have all the methods to screen the body, also the spine. So usually we do, of course, usually we do an X-ray at the beginning, but with an MRI, which is usually the method for that, to screen the spine perfectly. So with an MRI we know very easily what's going on, what kind of problem we have. So it's usually, the diagnosis is not a big problem.
So for the treatments, usually is it like just simple painkillers, or there's a treatment that can stop the pain forever?
Usually Western medicine, the procedure they do is first starting with painkillers. Different ways of painkillers. They kill it orally, injections, steroids. And maybe some physiotherapy together. In later stage, there's only surgery from the Western medicine. Surgery, of course, the idea is to kind of open the spinal canal so that the spinal cord is less pressed, less compressed. So they usually remove some of the bones in the backside, the lamina, in order to give the space give it some space. Or if it's more advanced, they also fixate the whole area, putting in some screws and rods, and fixate the area. Those options, we have to say, the outcome is not very good, because you have to imagine that those patients, the degeneration is already quite advanced, removing still some bones or putting in some screws, and so that has a big effect on the rest of the spine. So the degeneration might even speed up more by those kind of surgeries, so the outcome is not very good. From our side, what we are trying is, there are some herbal medications again, which have shown that they not just reduce the pain, but also have the effect of regeneration. We have seen that the medication, we call it shinbaro. It's a compound of different herbs, which is also scientifically tested and proven. So it showed that it also have a bone regenerative effect, cartilage regenerative effect, and nerve regenerative effect.
Very nice.
Yeah. So we are using these medications orally. If the patient is here and can get treatment regularly, then we also apply it as injections in the area where the problem is. Additionally, what we also can do is some very gentle and soft spinal manipulation.
Massage.
It's massage, but massage is usually more addressing the muscles.
Okay, yeah, this is for
but spinal manipulation, we call it Chuna manipulation. That's a kind of a manipulative treatment for spinal problems if the spine or the pelvic is misaligned, so we try to adjust it. Yeah. But it depends on the purpose. For instance, for spinal stenosis patients, we have to be very gentle. So we are doing very soft stretching along the spine, open the spinal joints a bit, very slight, in order that the blood supply into the minor areas there is increased. Yes. And that also can help to reduce the inflammation and at the same time easing up the tension inside the mini muscles and what there is, ligaments there. So those kind of soft manipulation can also help to release some of those tension. So that's basically how we address the problem. One is a medication that helps to reduce the pain but also regenerate the spinal tissue. On the other side, some soft kind of manipulative treatment. Of course, additionally, we do also acupuncture that can help to release pain but also release the tension along the muscles next to the spine. So that also helps usually to reduce the pain. So this kind of combination usually helps quite a lot. However, we have to say that once we know it's spinal stenosis, it takes time. Yeah, the treatment takes time. It's not a quick fix.
On average?
On average, we are looking, let's say for disc herniation. When there's the disc herniation, which we also treat very good. So with disc herniation, we look into around 3 months of taking the medication. For spinal stenosis, we look into at least 6 months.
So today we learned many things about spinal stenosis, and the doctor explained in details everything related to it using Oriental medicine. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.